Zika virus is a virus that is spread to humans through the bite of an infected mosquito, the Aedes aegypti mosquito, which is also the primary vector that transmits dengue, chikungunya, and yellow fever. This mosquito is found throughout different regions in the world, through the Americas, in Africa, in Asia, and also the Pacific Islands. In the beginning, when we first knew about this disease in the 1940s throughout 2007, it was very mild fever, rash, conjunctivitis, which is the reddening of the eyes. You can have muscle and joint pain. So basically self-limiting. Now with this virus, what we're seeing is that there's a question whether there are severe complications to Zika virus. And that could include a neurological type of complications, like Guillain-Barré syndrome, which is the weakening of muscles. Also, there's a question whether there's any association with Zika virus and congenital malformations like microcephaly. Right now in Brazil, they're reporting increases of microcephaly cases, which is the small heads of newborn babies. And so we're questioning whether there's any relationship between Zika and microcephaly. Well, there's no specific treatment for Zika virus disease, and there's no vaccine. However, we have seen that most of the cases are mild, or some of them do not even show any symptoms. However, if you do have symptoms, you can take supportive therapy medicines to cure your headache or your muscle or joint pain. Well, travelers should follow their guidelines from their respective own countries. As with all vector-borne diseases, we do advise all travelers, all people living in areas, subtropical and tropical areas, to wear protective clothing. For pregnant women, we advise pregnant women to seek consultation with their physician. Well, the best way to prevent yourself from getting bit by a mosquito is to use either mosquito repellent or protective clothing during the peak hours of when the mosquito will bite, which is usually early in the morning and late in the afternoon. And also for children or elderly or people that may be resting during the day, they can use bed nets to also create another barrier between themselves and the mosquito.
This is Jam Zen. It's January 18, 2016. I just want to make you aware of something they're calling the Zika virus, okay? Now, about a year or so ago, I got struck by the chikungunya virus, and this is supposedly carried by the same mosquito. Now, when that thing, chikungunya, came through Jamaica, I could tell it was definitely like a remote control thing. Whether it came by mosquito or whatever, these mosquitoes had some type of remote control. The way it walked through the country and the way people got infected and the way it passed. But crippling. And really, I had to give thanks when I got crippled by that. Because I actually had to ask my enemy. Because I was crippled, I couldn't even pull my sheet up. Yeah. I had to ask my enemy to help me with my own sheet. I was so crippled. That was chikungunya. And now they have Zika. And if you look at a Zika map from Brazil come up to America, it will frighten you. And it's all around the Caribbean now. Haiti admits having it. Jamaica says they don't have it. Okay? But they're going running all around. And the Ministry of Health in Jamaica just advised women not to get pregnant for the next 6 months. 4 to 6 months, I think they said, not to get pregnant for. Because they don't know what's going to happen. And America has, I think, a case in Hawaii that I heard about. But I don't know if they have any on the mainland. But this Zika virus is devastating to pregnancy or young children and causes a small brain type of thing where you're born subhuman. You're born subhuman. It's a very serious end times thing going on right now. It's called Zika, Z-I-K-A. This is Jam Zen. Bless up.
Several doctors have contacted the Los Angeles County Public Health Department asking for blood tests for patients exhibiting symptoms of the Zika virus, the department said Friday. The CDC says Zika virus is spread to people through mosquito bites. The most common symptoms of Zika virus disease are fever, rash, joint pain, and conjunctivitis, red eyes. The illness is usually mild with symptoms lasting from several days to a week. Severe disease requiring hospitalization is uncommon. In May 2015, the Pan American Health Organization, PAHO, issued an alert regarding the first confirmed Zika virus infection in Brazil. The outbreak in Brazil led to reports of Guillain-Barré syndrome and pregnant women giving birth to babies with birth defects and poor pregnancy outcomes. In response, CDC has issued a travel alert, Level 2 Practice Enhanced Precautions, for people traveling to regions in certain countries where Zika virus transmission is ongoing. The testing will be performed by the Federal Centers for Disease Control, CDC, in Atlanta, which so far has confirmed 12 cases nationwide. California at this point is not among the handful of states that have the materials to perform the test to identify the virus, which was unseen in the United States until recently. I will leave links in the description box. Please subscribe, like and share. Thanks for watching, be safe and God bless you all.
Y pasamos a otra información.
Así es, la Organización Mundial de la Salud ha dicho que hay un brote de Zika confirmado en el área del Caribe. La gran pregunta es si la República Dominicana estaría preparada para un brote de esta enfermedad.
Bueno, las autoridades, pero también la ciudadanía. Fanny Luna está con nosotros. Fanny, buenas noches, pasamos contigo.
Muy buenas noches, chicas, buenas noches a toda nuestra teleaudiencia. Señores, y República Dominicana se siente amenazada por otro virus transmitido por la picadura del mosquito vector del dengue, Aedes aegypti, epidemia que ha estado cobrando un gran número de vidas en nuestro país y en nuestra sociedad. Pero la pregunta es, ¿República Dominicana está preparada para esta enfermedad? La Organización Mundial de la Salud en este mismo año 2015 emitió una alerta para toda América Latina por la presencia de esta enfermedad en Brasil, Chile y Colombia. El virus Zika se originó en África, expandiéndose al continente asiático y en la actualidad presente en América. Es una enfermedad similar al dengue, pero con carácter menor. Vamos a conocer ahora los diferentes síntomas de esta enfermedad. En primera ocasión tenemos aquí el dengue, ya que es similar, que posee fiebre alta, dolor en las articulaciones, náuseas, vómitos, dolor de cabeza y lamentablemente en ocasiones puede causar muertes. Mientras que el virus Zika produce fiebre baja, enrojecimiento de los ojos, manchas rojas en la piel, dolores de cabeza, dolores en la parte posterior de los ojos y todavía no se han reportado ninguna muertes. Tras la picadura del mosquito, los síntomas de enfermedades aparecen generalmente después de un periodo de incubación de 3 a 12 días, mientras los síntomas en pacientes pueden permanecer durante 4 a 7 días. Se recomienda ya en el momento de tener detectada esta enfermedad, lo principal es asistir a un centro de salud asistencial cuando usted presente todos esos síntomas. Recuerde que no hay ninguna vacuna en esta ocasión específica para tratar este virus Zika, solo el manejo sistemático que consiste en descansar y en tomar medicamentos indicados para el control de la fiebre. Pero recuerde que estos medicamentos son solo indicados por su doctor. Se pierde muchísimas informaciones de esta enfermedad del Zika debido a la preocupación que realmente tiene la sociedad dominicana, y es por ello que el Ministerio de Salud Pública comunica a todos los dominicanos a trabajar en conjunto y a continuar con la prevención y la eliminación de criaderos de mosquitos. Recuerde, si usted presenta algunos de estos síntomas ya mencionados, no dude en acudir a su doctor.
Bueno, muchísimas gracias, Fanny. Luijo, presta atención a estos síntomas. Vamos a chequearlos.
when I heard of their new attack on humanity and the word Zika virus, I immediately saw the pharaonic word Ka, and I knew enough who's behind it all. Ka is the soul when alive and Ba when dead within the pharaonic belief system. Therefore, Ka also means the life energy as the Japanese ki, intrinsic energy, which the Japs got from the pharaohs and their Ka. So, with Zika, they attack our life force. In other words, Zika, the Zika virus, alters the human genetic Ka code. Furthermore, the mozzie that supposedly transmits the virus is called the Aedes aegypti, the Egyptian mosquito, Pharaoh's own personal weapon of mass destruction. Literally, Aedes in Latin means temple, shrine, or tomb. So, Aedes aegypti literally means the Egyptian temple or Pharaoh's tomb. As in the curse of Pharaoh from beyond his tomb, and probably related to Set on Satan's end times too. The Aedes meaning it will get us all into our tombs and sacrificed in Pharaoh's temple. Charming times coming up, folks. Moreover, the part Z in Zika, when translated from the Pharaonic, means bring to a third person. Here you can see it in this video here on my same channel. Now, why bring to a third person and not just another or second person? How come the pharaohs make this distinction? Well, because man is the first person, the woman the second, and their baby the third. As in the Zika virus, it has been transmitted to the third person, their baby. So Zika, Aedes aegypti, altogether means we'll bring the disease to a third person and sacrifice his Ka, life energy, on a pharaonic shrine. It's all there, folks, unmistakably communicating their secret words, symbols and numbers to each other. And the result of this satanic sacrifice is microcephaly, or pea-brains, to make the ultimate slaves for the Georgia Guidestones, leftovers of a farmed human race. And beware of the mandatory vaccinations coming up due to the Zika microcephaly, which is already mandatory in Switzerland since 2013. So the government in Pharaoh's base in the Alps can just force anyone for some vaccination made by Novartis Basel, who most likely developed the Zika microcephaly in the first place. Just as Swissy tried LSD on an entire French village, Swissy spreading the Ebola virus in Africa again, and the Swiss chemical industry worked together with Dr. Death to wipe out the entire population of Africa. I tell you, Swissy is the silent poison maker, Nazi financer and silent banker, hiding in the high castle of the Alps. And concerning microcephaly, I also have a peculiar cephalic skull form called a sagittal crest, which is a ridge on top of my skull, often related to aliens and extraterrestrials. Also found with primates, only their males, Bigfoot skulls, and related to almost inhuman strength. And I dearly hope I'll find that strength, contributing to defeat the enemy within, an enemy of mankind. Sagittal crest versus microcephaly. Sagittal crest versus Pharaoh.